Thank you, Chad. Well, a surgeon who specializes in breast cancer will offer a broader perspective on the entire package of breast cancer treatment and the many other treatment options. Joining us now from UNM Sandoval Regional Medical Center and UNM Cancer Center is Dr. Stephanie Fine, the breast surgical oncologist. This one, we were just talking about 1 in 8 women.
Correct.
So you probably know somebody that is affected by this.
Everyone knows someone with breast cancer because it is 1 in 8 women.
Yeah.
And so, you know, someone in your family or, you know, it might be just a friend or an acquaintance in the office who's maybe never mentioned it, but everyone knows someone with breast cancer.
Yeah. So what is the role of the self-described breast surgeon?
Breast surgery and breast cancer therapy has just expanded so rapidly in the last, 10 to 15 years that it's very difficult for the person who traditionally took care of breast cancer patients, which was the general surgeon. And by that we mean a specialist. They did all the gastrointestinal work and hernias, et cetera, and breast cancer. But now it's so sophisticated that we really need a niche person to be able to give someone the best option, to really look at the bigger picture, and offer the best treatment option for the patients. We do it as a team approach as well.
Yeah, so what's the most important advancement that has happened, that has come along?
I would say that the most important thing in the last 10 years is the concept of targeted breast therapy, where we're looking at patients that have specific subtypes of cancers, and we can actually tell them what subtype that they have and how that's going to respond or maybe not respond to chemotherapy.
Okay. Now, my grandma has been affected by breast cancer. I don't know if you say has been or if you say is currently going through. So I'm assuming I'm somebody who should have genetic testing. Who all should have genetic testing?
Interestingly, only about 5 to 10% of women actually have a what we call a foundation mutation, or a mutation that is tracked down through many generations in the family. Most breast cancer, 90%, is what we call sporadic, meaning it just happens.
So it's not necessarily that you get it and it's in your family line. It's just
if you're female, you're prone to it. And men, there is male breast cancer as well. However, about 10% of women will benefit based on their family history and some other criteria that we look at, and we follow nationally recognized criteria to determine who's going to benefit from real genetic testing.
Okay. Now, what's the controversy over mammograms? Who should get them?
Exactly. There is a lot of controversy because papers keep coming out now that are sort of swaying people in the direction of not getting mammograms. And there's a lot of, again, the controversy is not over. It's still in there in the ring. But what we're going to do is probably target people who really are higher risk for breast cancer, and they will be the ones that will be getting annual mammography in the future. I mean, right now we say, please get your annual mammogram starting at 40. I think in the future we're going to kind of look at, again, more targeted approaches to who needs every 2 years or who needs every year mammograms.
Okay. Now, let's talk about self-exams. Women should be doing self-exams. Now, how often? We'll start with how often.
We still vote for monthly.
Monthly,
and we feel very strongly that a woman should be aware of her own breast character and texture and be able to do an exam herself.
Okay, and what's something that would be very concerning that you should go see your doctor about?
If you find a lump that you cannot find, say, a matching partner for, either on the same side or the other side, really need to have that looked at. Any kind of skin change, especially around the nipple, any contour change. We ask that you raise your arms up actually in front of a mirror, because you might detect a little dimpling or contour change that you didn't appreciate before. Any kind of discharge that looks bloody to you, or any postmenopausal woman with any kind of discharge should really probably be seen.
Okay. Now, can people get a hold of you?
Absolutely. At either the main cancer center or Sandoval Regional Medical Center, which is the new hospital on the west side.
Okay. Thank you so much.
Thank you very much
for
having me.
Very helpful.
In
Well,
advance
if you want to
of October.
recap, or if you want information of how you can get a hold of Dr. Stephanie Fine, just go to CASA.com and click on the Style tab. We're going to send things over to Chad.